Hi, welcome to my channel. Welcome back. It's Dr. Erica. Thank you for joining me again. Pharmacist for 12 years now, registered and licensed in the States. Welcome to my channel. I'm going to talk about antidepressant medications. Please like, share, and subscribe if you would. Also visit my main, which is called Erica OnagbolaPharmD. That is my main channel. I want you to subscribe and also share with others as well. That channel is talking about disease states, medications as well, what to look out for, what to expect when taking medications, what to think about, when you're taking the medications, who to talk to when you have a side effect, what you can do at home to relieve symptoms, things like that. Before taking a medication, what do you need to think about first? So in this particular video, I'm going to talk about antidepressants. Antidepressants are those medications that are used for medical conditions such as depression, of course, anxiety, bipolar disease. Also, there are other indications as well that may not be listed as primary indications. So antidepressants do have side effects. One of the main side effects is going to be weight gain and sexual dysfunction as well. Also, there may be symptoms of tremor, seizure, increased heart rate, increased heart palpability. Also, there may be drug interactions as well with certain medications. So when you're taking this medication class with any other medications that may be new or over the counter, please talk with your doctor or your pharmacist to let them know so that they can make adjustments as needed. Also, these medications can change the heart rate as well as the blood pressure. There are some events where medications in the class may be more prone to certain drug interactions and drug adverse effects than others. So do please monitor yourself and then let your doctor or your pharmacist know if there's anything that seems to be off with your medication, and maybe they could switch you or increase or decrease your dose of that particular medication. As well as poor appetite, there may also be a change in smoking habits if you are a smoker of tobacco. And then also there may be a change in your decision-making skills. So because of the different classes, you may or may not experience these particular ones. It just depends again. It may take 6 to 12 weeks for an individual to experience a relief in their anxiety or depression. Again, about 4 to 12 weeks typically before you begin to feel, those improved symptoms. Also, please be mindful that just because you're taking an antidepressant doesn't mean that it's going to work right away. You have to give it that ample time that's needed. And then also, please be aware of the drug interactions again, and also the side effects. There may be stomach upset, there may be dizziness, there may be a headache, there could be all types of GI upset, nausea, vomiting, diarrhea. There also could be, they are affordable. Antidepressants are affordable. So do be aware that it's not a strain on economical abilities. So you can get a 30 count or a 1 month supply of an antidepressant for as little as maybe $10, $15 with your prescription insurance if you have that coverage. Even if you don't have that coverage, you may only pay no more than maybe $30 to $40 for a particular 1 month supply. Be aware there is a suicidal risk when taking antidepressants. Again, there is a suicidal risk when taking an antidepressant. So do be mindful. And then, last but not least, there's a newer class of antidepressants that are maybe more specific. They may be more more helpful with other disease states that if you qualify. Say if you are a smoker of tobacco and you want to clear depression at the same time, so you can take an antidepressant class or bupropion, which is also Wellbutrin. You can take that, and you can also help with your smoking cessation. Then there's the other class that I won't mention, but there are other classes that are uh, more recently approved that you can use as well. And then the weight gain is more so with like your sertraline, your escitalopram or Lexapro, um, your Remeron or your mirtazapine, your Paxil, Cymbalta, and your Trazodone. Those are the ones that are tending to be like more susceptible to a person gaining weight. So if you're one of those patients who are taking the new GLP-1s, or if you're someone who is um, taking medications that affect your weight, like birth control, oral contraceptives, for example, all those cause weight gain. And when you take those, be mindful that the antidepressant can also be one that actually, may enhance that as well. Okay, I talked about suicidal risks. I talked about cardiovascular risk, changes in heart palpitations, QTC interval changes, electrolyte changes that affect the heart, dehydration that can affect the heart as well. So, again, dehydration is another side effect of antidepressants, as well as sodium depletion in our elderly patients. So, electrolyte depletion or change, and then sodium depletion or change. And then also muscle rigidity, like when you have muscle spasms, for example, that it could be a cause of an antidepressant use. Also, to make mention, it's good for a pharmacist or a healthcare provider to talk with the patient, to ask questions. For example, what symptoms are you experiencing? What what has gotten better? What has gotten worse? What has changed? Is there anything that you need to talk about that you might have not have mentioned before? For example, tolerability rate. Again, I talked about affordable. Patients do have the option to request a drug over another drug, but again, the doctor will have the final say. Usually, they will titrate low and go up to the next approved dosing after maybe a couple of weeks to see how that helps with side effects, if that decreases the side effects or it doesn't, or if they need to switch to a different class. So it just depends on each individual situation. Hopefully, with the tapering off of the medication, it's not a long-term use medication, maybe 1 year up to maybe a year and a half, possibly, that a patient may be on an antidepressant. But again, you have to be tapered off with a official approval of a healthcare professional, and that's usually going to be your physician or your nurse staff together. Okay, so again, people are usually on it for a year or a year and a half. It's never a long-term use, but I have met customers who come in and say, um, I need a refill on my medication. I'm used to. I don't need any, extra um, talks about the medication just because I've been on it, all of my life, or I've been on it for such a long time. You can you can just go ahead and save all of that information for someone who's naive to this medication, because I have been taking it for such a long time. So if it ever you decide you're comfortable where you are with your medication, you can continue long term with that medication. But usually the end goal is 12 months to 16 months. Okay. So do be aware of that. And most antidepressants are officially approved for the primary indication. So you don't have to worry about it being a test drug or an emergency drug or something that is, in laboratory still being tested. These particular medications are ones that have on the been out there and have been proven through research, official approval. Okay. Now, there is a pharmacogenetic testing for 2D6, CYP2D6 enzyme testing, because it's not an absolute drug testing, but tool to test if you have a um, genetic ability to produce this enzyme, because this enzyme CYP2D6 interacts with antidepressants drugs to either um, enhance its accumulation in the bloodstream or to decrease its accumulation in the bloodstream. And there is a testing tool through your healthcare provider that could help determine whether or not you're more prone to it or not. So do be on the know of that. Okay, so that's what I want to talk about in this particular video. If you have any questions, concerns, please let me know. Like, share, and also subscribe as well. And I hope this has been helpful to you. And thank you for joining me. Please check out Erica OnagbolaPharmD, which is the primary channel that I have about antidepressants, diabetic medication, heart medication, heart disease, things of that nature. So please like, share, and subscribe. I'm Dr. Erica. Thank you for joining me. It's been my pleasure. I'm signing off, and I hope to see you on my next video. Take care. Bye-bye.